Hey everyone, thanks for joining me again. For those of you that may not remember, the last video was about what trauma was as well as examples of trauma. So if you would like to know what those are, please see my previous video that I have posted. So now we're going to move on to how is trauma stored? Well, as you can see here in this slide, the trauma is stored in our brain and in our body. It's really particularly stored in the body and in the nervous system for those that have experienced preverbal trauma. And preverbal trauma is trauma that happens to basically young children who don't have the capability of speech or language quite yet, right? So they can't really express things. That's where trauma usually gets stored, is in the body, in their nervous system. And again, this is due to memory not really starting until the age of 3. So as you can see here in the gingerbread person, trauma can be stored in the body in so many ways, right? So we'll have a lot of chronic pain could be symptoms of trauma. We also have severe headaches, disassociation. Disassociation is where you feel like you're leaving out of your body. Sometimes you can't really remember things that were happening around you, and this has happened. This is a way of your brain protecting itself, right? So it's a way of your brain escaping your body so it's not hurting anymore. There's all these other issues that will show you how trauma can be potentially stored. All right, so next we're going to talk about some things to consider when thinking about trauma and how it's affecting your child or yourself even. All right, stay tuned.